Welcome to the STEMS Health Miami Stem Cell Therapy Podcast. STEMS Health is a regenerative medicine clinic in Miami Beach, specializing in advanced non-surgical treatments that help the body repair and restore itself. Visit stemshealthregenerativemedicine.com for more info or to book an appointment. From stem cell and PRP therapies to peptides, IV treatments, and hormone optimization, our focus is on helping you feel, move, and perform at your best. This synthetic podcast brings you clear, physician-guided insights into how these treatments work, what to expect, and how regenerative care is transforming modern medicine. Now, here is today's topic. What is cell potency, and why does it matter in therapy? When people hear the term stem cell therapy, they often think about regeneration, the body's ability to heal itself from the inside out. But behind that powerful idea lies a crucial concept that determines how well those therapies work. Cell potency. Cell potency is what defines how many different kinds of cells a stem cell can become. It's the foundation of regenerative medicine, influencing everything from which conditions can be treated to how safely and effectively those treatments perform. Today, we're going to explore what cell potency really means, how scientists measure it, and why it's one of the most important factors in modern cell-based therapy. Let's start with the basics. What is cell potency? Cell potency refers to a stem cell's capacity to differentiate. In other words, its ability to develop into other types of cells. Some stem cells have almost limitless potential. Others are more specialized. Understanding where a cell falls on this scale helps doctors and researchers decide which type is best for a given treatment. Imagine it as a hierarchy, a kind of family tree of regeneration, starting from the most powerful all-purpose stem cells and narrowing down to cells that can only repair certain tissues. At the very top of that hierarchy are totipotent stem cells, the most powerful of all. These rare cells appear only in the very earliest stages of human development. Within days of fertilization, they have the extraordinary ability to become any cell in the body, even those that form the placenta and other supporting tissues around an embryo. Totipotent cells represent the ultimate regenerative potential. However, because of ethical and technical limitations, they're not currently used in clinical therapies. Instead, their value is mostly theoretical, helping scientists understand how life and healing begin at the cellular level. Just one level below are pluripotent stem cells. These are among the most versatile cell types that can be used in regenerative medicine today. Pluripotent cells can develop into any of the three major germ layers that form our body's tissues: the ectoderm, mesoderm, and endoderm. That means they can become neurons, heart muscle, liver cells, or skin cells. Two major types of pluripotent cells dominate research and clinical trials: embryonic stem cells, which are derived from early embryos, and induced pluripotent stem cells, or iPSC, which are adult cells reprogrammed back into a stem-like state. Pluripotent cells are powerful because they can self-renew indefinitely in the lab and provide a nearly unlimited source of specialized cells for therapy. They're being studied for conditions like Parkinson's disease, diabetes, heart failure, and spinal cord injury. The challenge: controlling them precisely. Because pluripotent cells can become almost anything, they require careful guidance to ensure they become the right cell types and don't form unwanted ones. Now let's compare that to multipotent stem cells. Multipotent cells are more specialized. They can only develop into cell types within a specific tissue family or organ system. For example, hematopoietic stem cells form all types of blood and immune cells. Mesenchymal stem cells give rise to bone, cartilage, and connective tissue. Neural stem cells can produce neurons and glial cells. Adipose-derived stem cells specialize in fat and related tissues. While they don't have the same broad potential as pluripotent cells, multipotent stem cells offer two big advantages: accessibility and safety. Because they're found in adult tissues, they can be harvested from a patient's own body, which eliminates most ethical concerns and reduces the risk of immune rejection. And because they're more restricted in what they can become, they carry a much lower risk of forming tumors or inappropriate tissue types. That's why multipotent cells such as bone marrow-derived stem cells and adipose-derived stem cells are already widely used in clinical applications. From orthopedic procedures to blood and immune system disorders, When comparing multipotent versus pluripotent stem cells, the choice often comes down to a balance between potential and practicality. Pluripotent cells offer immense flexibility, but they require sophisticated lab controls and safety measures. Multipotent cells are more limited, but far more ready for use in real-world treatments today. In other words, pluripotent cells represent the frontier of regenerative research, while multipotent cells are the backbone of current regenerative care. Therapeutic implications of cell potency are vast. The potency level determines which diseases or injuries a therapy can target and how effective it may be. For instance, multipotent stem cells are already FDA approved for certain uses, such as bone marrow transplants for leukemia and other blood cancers, as well as orthopedic and musculoskeletal applications. These therapies rely on the cell's ability to regenerate a specific type of tissue safely and predictably. Meanwhile, pluripotent stem cell therapies are moving through clinical trials, showing promise for more complex and widespread diseases like macular degeneration, Parkinson's, and even diabetes. But their complexity means they're still under rigorous study before broader approval. At the same time, personalized medicine is emerging, an approach that considers a patient's age, immune system, and disease type when selecting the right cell potency for therapy. For some, multipotent cells may offer better safety and faster results. For others, pluripotent approaches could provide deeper regeneration over time. So how do scientists measure cell potency in the first place? Modern research uses advanced tools like single-cell RNA sequencing and epigenetic analysis to examine what genes are active inside each cell. These techniques reveal how stem-like a cell truly is and how easily it can transition into another type. Scientists also use differentiation assays and functional tests, basically seeing what a cell can become under different lab conditions. Much of the research today focuses on comparing induced pluripotent stem cells to embryonic stem cells to see whether they behave the same way and hold equal potential for therapy. The goal is to refine stem cell sources that are both powerful and ethically sound. In the near future, real-time potency monitoring, systems that can assess a cell's state as it's used in therapy, may help doctors further improve safety and outcomes. At STEMS Health in Miami Beach, our double-board certified physicians are helping patients benefit from these regenerative advances. We provide stem cell therapies for a wide range of conditions, from joint pain and sports injuries to hair loss, TMJ disorders, and other degenerative concerns, all with an emphasis on personalized, precision-based care. Our goal is to match the right treatment and the right cell potency to each patient's unique biology and health goals. Here are a few quick answers to common questions. What determines a stem cell's potency level? It's influenced by genetics, epigenetics, and environmental factors that control how genes activate during cell development. Can multipotent cells be converted into pluripotent ones? Yes. Scientists can reprogram adult cells into induced pluripotent stem cells, though this requires advanced lab techniques. Which type of cell is safest for therapy? Multipotent cells are generally the safest, since they're more predictable and less likely to form unwanted cell types. How do doctors measure potency before treatment? Through laboratory testing that includes genetic markers, differentiation studies, and cell functionality assays. Do more potent cells always mean better results? Not always. The key is matching the right potency level to the right condition, balancing regenerative power with safety. As regenerative medicine continues to evolve, understanding cell potency helps patients make informed decisions and appreciate the science behind every treatment. From pluripotent breakthroughs in research labs to multipotent therapies available today, the future of healing depends on how well we understand and responsibly harness the power of stem cells. If you're interested in learning which regenerative treatment might be right for you, schedule a consultation with STEMS Health Miami Beach, where science and precision meet to help your body heal naturally. That's all for this episode. Thank you for listening to the STEMS Health Miami Stem Cell Therapy podcast. This podcast is for informational and educational purposes only and does not constitute medical advice. Listeners should consult a licensed healthcare provider for individual diagnosis or treatment. Some therapies discussed may be considered investigational or are not approved by the FDA. Results and outcomes vary for each person, and no guarantees of benefit are implied. All participation in such treatments is voluntary. To learn more about regenerative and restorative treatments, visit stemshealthregenerativemedicine.com or schedule a consultation at our Miami Beach clinic. Stay tuned for the next episode of the Miami Stem Cell Therapy Podcast, and have a great day.